All right, so David's gonna present and Kevin's gonna discuss, and this is one of like 3 difficult cases we have.
Feel bad.
Yeah.
Okay, so jumping in, this is a lady who was referred to clinic for this non-specific vision loss and quote, funny looking retina. Her vision's a little bit decreased. She's 20/40 in the right eye, 20/60 in the left, and her pressure is normal. She's got this history of kidney disease. It's been going on for a long time. She's on dialysis. She has osteoporosis, some surgical history. I think the surgeries in the arm are for the AV formation. And then on some systemic meds, she's on immunomodulators, and then some other standard stuff, but including the diuretics for her renal disease. This is, oh, sorry, Kevin, go ahead.
Right, colored fundus photo of the right eye. So media looks clear, nerve looks pretty normal, maybe just a little blurring there nasally, but I think that's artifact. Good pink color to it. And then macula, I don't really see any pathology, and vessels look pretty healthy, no increased tortuosity. I don't really see any AV nicking, although she does have history of hypertension. But this is her healthier eye. So let's get to the other eye. Unless you want to point out something, David.
Well, possibly, we'll see.
You wait.
Left eye, so again, media looks pretty clear to me. Nerve, maybe a little bit more color to it in certain areas, but that same kind of haziness, but I think that's just artifact. Good, healthy looking vessels. I mean, there is like this kind of orange look to the fundus there inferiorly. I don't know, you want to flip back between the right and left eye real quick?
It's, that screen is kind of shitty. If you look at my laptop, it's like, it looks better. So the screen up there is kind of making everything look orange. It's like a color balance is off.
Yeah.
So before we get too far into it, I would say they're both pretty normal looking. On the left eye, there's this little cream colored, I don't know if you can see my mouse, but just, just south of fovea, there's a little cream colored lesion. It's a Wepelmann-Ditzel, and we will ignore it. But I think you could argue that there's something missing. It doesn't show up often on fundus photos, but when we do the exam, we see it pretty clearly. But I think.
Go to the next. Can you see the next photo? Will make it be able to see.
All right, so IR, looking at right and left eye.
Kevin, I'll give you a hint. It's an absence of something.
Okay, I guess looking for the fovea, like underlying choroid with the foveal reflex.
Yeah. So this is an IR photo, and you don't really see that reflex.
The IR doesn't always show it though. The autofluorescence does.
It's tough to. It's a very tricky. Like I was saying.
Is there an autofluorescence?
Yes.
Oh, show that. There you go.
Okay. I mean, it looks pretty symmetric in both right and left eye. I do see those little small splotches of hypoautofluorescence, one of them corresponding to that cream colored spot you pointed out. But yeah, usually with autofluorescence, you're gonna have, or excuse me, those were hyper autofluorescent little spots. And then with autofluorescence, you're gonna get more of a hypoautofluorescence with your normal foveal reflex.
Right, exactly. So this is in both eyes, the fovea seems to be, well, missing. So here's the OCT.
Okay, yeah, and if you're cutting straight through the fovea there, which it looks like you are with that grid, you really don't see that normal foveal contour. So maybe
Exactly.
you'll hypoplasia or something. And again, symmetrically cutting through that fovea in the left eye, just straight retina, straight OCT. I don't see that foveal indentation.
And you have to be careful, because if you're off center, you'll get this, but this one I did a raster and there's nothing there. That's the best you get.
Yeah, exactly. Don't see the nice foveal contour. You just see the nuclear layers just going straight across.
Yeah.
So thickness maps, just redemonstrating what we saw. There's no foveal contour. So, in summary, we just see this foveal hypoplasia. Maybe on the color fundus, we didn't see too much of that pigment in the macula, and then again on autofluorescence, didn't really see what you'd normally expect. So, what is the diagnosis, Kevin?
Foveal hypoplasia.
Exactly. So what?
You gotta let him come up with a differential. That's the hard part.
Okay. Okay.
Because it's
Okay, there's one high yield, most common association with foveal hypoplasia.
What's that?
What is the most frequent association with hypoplasia?
Guess what? I saw albinism is.
Sorry. Yeah. And then it has a number of other associations. So again, more aniridia associated with PAX6, so some dysgenesis. And this is a list I got from iWiki. And interestingly, at the very bottom, they added Stickler syndrome, and I didn't see that really anywhere else. I thought, Dr. Cohen, did you?
Yeah, I've had a couple Stickler's patients. I don't think they have this, so I think you can get the phobia kind of dragged around, but I wouldn't hang my hat on that. And the other thing is isolated foveal hypoplasia is not super uncommon. So you'll find, I'd say probably in my experience, I don't know, 80% of patients are just isolated. So it's not necessarily associated with anything.
Okay.
It's like uveitis, half the time it's just uveitis. But as far as that associated diagnosis, this is a good list.
Yeah, so I was thinking, well, did they mess up their collagen disorders, and were they thinking Alport syndrome? Because that would explain this lady's long history of renal disease. I don't know. So in this patient, we don't know the answer. She unfortunately was refusing genetic testing. So I don't know if there are any updates on that, but at the moment we don't have.
She just refused. I was gonna pay for it because I really wanted to know. Especially with the renal failure, it's fine to know, because the renal failure, I said you might have systemic association. But but that was the thing that I thought was interesting with the case, was the foveal hypoplasia and renal failure. And she wasn't a slam dunk albinism patient. I've had a couple. I had one funny guy. I had this 80-year-old guy who had foveal hypoplasia, and I asked him if his hair was white his whole life. He said, yeah. And he said, I said, I think you might have. He said, my brothers used to make fun of me and call me an albino all the time. And I said, I think you might have albinism. And he says, don't tell my brother. So you ask him like a history of white hair, but this one wasn't like an obvious albinism one. So I kind of wanted to get the genetics.
So I was going to break down albinism a little bit. A lot of this comes from a really great episode of the Eyes for Ears podcast. If anybody is not listening to it, I recommend it. But there are, I guess, three forms of albinism that we'll be dealing with. There's ocular albinism, where it's this albinism limited to the eye being involved. Oculocutaneous albinism, as the name implies, it also involves the skin. And then we have our syndromic albinism, so a syndrome, and I'm going to highlight three. There are a couple others, but I think these are the highest field. So these syndromes that present with albinism and ocular albinism as well. With albinism, you're going to see a number of signs and symptoms, and I don't think you should expect to see all of them, but maybe just some of them. They classically present with a pendular nystagmus, and we'll go front to back. So you see this abnormal eye movement, you see light irises. In the podcast, they point out that they can appear a purpley hue. If it's light plus the red reflex, it can appear purple. And they're speculating that the Targaryens from Game of Thrones may have had albinism because they have this white hair, white skin, and purple eyes. So now that's just stuck in my mind. But with the light irises, they may have photophobia. They don't have a good job blocking all the extra light. Moving back, foveal hypoplasia, like we've been discussing. And then they can have these optic tract decussation abnormalities. I saw somewhere up to 90–95% of decussation. So they have this abnormal pathway. I don't know how this happens, but tracking. So normally you expect somewhere between, something like 50%, 52% of decussation, but this is very abnormal and they have this crazy laterality.
It'd be interesting if they had a stroke, like the visual field, if they had a stroke, I guess would be different, right?
Yeah, I don't know. But it's very interesting, and I don't know where in, the embryologic development this happens. But it's interesting. The skin, like I was mentioning, can be involved, whether it's ocular versus oculocutaneous albinism. And the podcast breaks this down. I tried to do some background research, and I didn't find a lot to back this up, but they were distinguishing ocular versus oculocutaneous albinism and how the depigmentation occurs. So in ocular albinism, they have fewer melanosomes, while in oculocutaneous albinism, they have less melanin. I don't know. I haven't seen that around as much, so I don't know how true that is, but I assume they did their own research, and if this shows up on boards, here you go.
Oculocutaneous has less melanin. That's what it says. PCS.
It's a good use of fewer and less, actually, too.
Sorry?
It's a good use of fewer and less. It's like fewer cups of coffee, but less coffee.
Yeah.
Oh, yeah.
Fine.
That's one of the things that got drilled into me as a kid.
I can imagine. That's not an easy.
Yeah. When you go to the grocery store, it's not 10 items or less.
Yeah.
It's 10 items or fewer.
You're right.
So the pathophysiology of the foveal hypoplasia, and I guess lack of development, is not understood. There's some speculation whether you have this absence of the avascular zone, and maybe it's the presence of the vessels is creating some mechanical stiffness. We don't know. So I didn't go into the speculation, but we don't know why this happens. So to discuss some of the systemic forms of albinism, we have Hermansky-Pudlak syndrome. So the podcast, they have a good set of mnemonics for this. I think a lot of P's, platelet storage deficiency, pulmonary disease, colitis, and you can think of a P word that is associated with that, and patients of Puerto Rican descent, but also the Swiss. So it's the P's and the F's at the end. Chediak-Higashi, this is a neutrophil disorder. It's a trafficking, intracellular trafficking disorder. You have a manifestation of albinism, polyneuropathy, and you have these recurrent pyogenic infections. This is one of my favorite diseases from med school. We had this group, and if you'll indulge me for a second, we had this group where we shared terrible mnemonics. And if you want to go back, you can watch this clip here. It's from the Music Man, where they do this terrible rap. Well, it's not terrible, it's just very old school. And it's a bunch of guys rapping, and they're talking about the Music Man, who's a traveling salesman. He joins the troupe. He goes town to town selling people snake oil. So in the song, they're on a train and they make this sound that sounds like, they go, "What do you talk? What do you talk?" And it just sounds to me like Chediak. And the train is hissing, "Higashi." And I cannot get it out of my mind. And in the song, they talk about how he doesn't know the territory, you know, the selling and salesman territory. So I always think, okay, polyneuropathy, you don't know the territory. So this whole thing is just the worst mnemonic ever, and I will never forget Chediak-Higashi syndrome.
I'll agree with that.
And and like I said, and it's a bunch of white guys rapping, so I think albinism.
Seriously, Mo.
Whatever works, that's good.
Yeah.
Neuronal storage in your brain, you're
You're sucking
using
up.
on this mnemonic. You'll never see it. I've never seen it.
It's
You'll
like
never
when
see
people
this.
put 911 into their phone, like you just dial like 5324 and it gives you 911. You know, I've heard of people doing that. You know, pre-program it.
I cannot wait to see this in my career. So thank you for indulging me on that one, but this is my favorite disease of all time.
Yeah.
So finally, the third that I'll discuss is Waardenburg syndrome. You know, heterochromia, this broad nasal bridge, the eyes will seem to be laterally displaced. And you get this patchy depigmentation. They're mnemonic in the podcast. They like the name Waardenburg. The two A's are just being separated. So they think of the broad nasal bridge and the lateral extension of the orbits. And then finally, just maybe Alport syndrome. This is my speculation that maybe this is what this patient has. I saw
Read Delta 1.
I saw there are some instances of reported foveal hypoplasia. It's not a slam dunk, but it does have a lot of ocular manifestations and, of course, renal disease. So throwing it out there, wondering if this is what the patient may have. But like I was saying, there were some reports of foveal hypoplasia. This was not in BCSE or iWiki. These are my references, of course, including the Music Man. So thank you.